Hello, I'm Alison, Chief Exec of Exudate. This video is part of a series where we're hoping to help you with the self-management of your wounds. So let's have a look at what you need to do to have better conversations. So the first top tip is to get a little notebook. What you need to do is just really get the information together so that you can have a better conversation with your nurse. So the first thing is, what information have you been given about your wound, about management, and about how to use dressing packs and so on. So the second thing is, have you got everything you need? So have you got at hand dressing pack, a dressing, whatever you've been given? Have you got creams ready? Tape? Bandages? Or even wraps? It doesn't matter what you've been given. The point is that you've got it all ready and that you're in a comfortable place to manage your wound and to feel comfortable in doing that. Have you taken painkillers? Is your wound painful? If it is, any exposure to the air can be painful. So make sure that you're prepared and you've already taken the painkillers. Have you got someone in your family that's going to be doing the dressing themselves? Are they confident in it? Have they been told what to do? Do you feel confident in them doing the dressing? Is there any particular place that's painful that they need to be aware of? What do they need to know and what do they need to feel confident in? So again, be prepared. Make sure that you've covered all these things. Don't expect someone just to know what to do. So when it comes to getting objective feedback, there are going to be some questions that the nurse will be asking. So you will be familiar with many of these. The first question is always about pain. What is your pain like? Have you got a score that you would give your pain? What type of pain do you have? Can you describe it? What are your words that you would use for your pain? Is it dull and throbbing, or is it sharp and sore, or even burning? Those descriptors are really important for the nurse. A pain level means nothing if we don't have a little bit more context. If you have a burning pain, then you may need a different painkiller to the dull, throbbing, constant pain. So those things are really important for you to try and tease out. What are you experiencing? Also, if it's more or less than usual, it's really important to know these things. One of the things that you would be used to discussing with your nurse is the type of wound bed. How would you describe it? When you look at it, would you say that it's looking healthy or not healthy? Some words to help you with that would be pink, red, yellow or black. So if a wound is healthy, it's generally pink. You may have heard the word sloughy. This is where you've got a covering to the wound that may or may not be inhibiting healing. But if you've got part of the wound covered by slough, this yellowy material, how much? Would it be 50% or 100%? These are the type of things that you can help the nurse understand what you're seeing and experiencing. Of course, a photograph is fantastic. If you're a patient of Exudate's, we have a dedicated email now so that you can send photographs in of your wounds. This is really, really helpful because it means we're talking about the same wound and that we've got the same picture in our heads. So please see if you can take a picture and email it to your nurse. If you've got what you would describe as black patches on the wound, that would be a concern for us. And so it's really important that we describe that well. And the other thing is the surrounding skin. If the surrounding skin is healthy, then note it, that's brilliant. If it's a bit red or hot, then that's really important for us to know. It's really important for us and for you to know if something's getting worse, as in there may be an infection starting, or whether that inflammation, that redness is going down. That shows progress. So whatever it is that you do have or you don't have is an important part of the story. Having an objective measurement of your wound is really important. So in your dressing pack, you will have a measuring tool like this or similar. So just measure the wound, the widest length that you can find, and jot it down in your book. Report back to your nurse. It's really important information. One of the other things that again you'd be used to maybe discussing with your nurse is the presence of exudate. Exudate is the wound fluid. Wound fluid is incredibly normal and important part of wound healing. But if there's too much of it and it can't be contained in the dressing, then the surrounding skin can be really soggy. Are you seeing that? Or is it nice and dry and healthy? So again, the presence of excess exudate is really important. One of the words that we would be looking for is the word strikethrough. So what that means is when you have a dressing, okay, let me just open this up. The exudate is meant to be just contained in the dressing. If it comes through to the outside, that's where we call it striked through the dressing. Now again, that may not be a problem, but if it is absolutely saturated, then the exudate will then go onto the bandages or the hosiery or the wraps. That's more significant. And again, that level of strike through is very important for the nurse to know about. If you've got an abdominal wound, then the dressing is very important for managing the exudate. And basically that's the last layer that you have. If you have a leg ulcer, then you may have a variety of compression systems or bandages on your leg. So just because they are on and staying up doesn't mean it's an effective bandage. So again, I'm hoping that you would have had that discussion with your nurse about the firmness of the bandage and whether it's feeling effective or not. A rule of thumb is, if the exudate is increasing, then we need to really look at the level of compression you're having from your bandage system or your wraps. That's in another video. The final thing to think about is skincare. This is really, really important for any wound, but especially of the lower leg. And there's lots of videos around about making sure you manage your skin appropriately and make sure that you moisturize well. Standard moisturizer is very, very important. Cleansing of the wound is obviously a very important part of wound management, and there are some really good, useful videos on this. But just to remind you that tap water is mostly fine for all wounds, especially leg ulcers. So having a shower and a wash down before you do your dressing is a really good way of feeling fresher. If you've got an abdominal wound or a surgical wound or a new burn, you might be advised to use the saline sachets. But otherwise, tap water is absolutely brilliant, and making it warm is more comfortable. So this was a short video to help you have better conversations with your nurse. I hope some of the discussion has been useful for you.